Do you know someone who sustained an on-the-job injury? Maybe it was a friend, a coworker, or even yourself. One of the most common forms of workplace injury occurs when attempting to lift or move an object. The human body is a miraculous machine that can work well in either a highly repetitive or constantly changing environment. Soft tissue injuries usually come in 3 different forms. A strain occurs when a muscle is pushed too hard. A sprain is when a ligament or tendon is stretched beyond its normal capacity. And finally, a tear is when the soft tissue begins to break apart, either partially or totally, in what is called a rupture. All of these forms come with pain and decreased ability for our body's movement in the time immediately following the injury. Recovery can range from a few days for a light strain to requiring surgery with a multiple-month recovery timetable. There are techniques that you can adopt to reduce your risk of sustaining a lifting or movement type of injury while on the job. The oldest and most common lifting best practice is to lift with your legs and not with your back. When performing a lift with an object on the ground, it is easy to fall into the habit of simply bending at the waist as we reach down with the intention of picking up that object. Under normal circumstances in which we are only moving with our body weight, it is a generally safe movement for our body's anatomy to do. If we are rushing or if our mind is elsewhere, we can very easily fall into this routine habit. And if we add weight of an object that we are picking up, this places additional force on the muscles in our lower back. Proper lifting technique instead places one foot next to the item being lifted and another foot approximately shoulder width away. The item should be in between your feet and slightly in front of them. You will want to bend at the knee and lower your torso close to the object if possible. Keep your back straight, secure a firm grip on the object, then lift by simply standing up with your legs. Try to keep the object close to your torso. You then can transport or set the object down wherever you desire. One of the most important points of this safe lift is to use your body's larger leg muscles to lift the weight rather than the smaller and more easily injured back muscles. This is the same lifting technique that all the gym bros would see in the weight room when performing a squat exercise. The object being lifted, however, is not on your shoulders, but from the floor. Avoid bending your back and monitor where you feel the weight in your body when performing the lift. Always know your safe lifting capacity. The average human should be able to safely lift approximately 20 pounds repetitively. Be extra cautious when lifting items greater than 50 pounds by yourself, and you should start looking for additional support such as a team lift or using a piece of equipment such as a forklift for lifting items greater than 75 pounds in weight. It is easy to get caught up in what we are doing, and it may take additional time to obtain another employee or a piece of equipment to help you perform a heavy lift. However, it will take much longer for your body to recover from an injury than it will to obtain help. Not every lift is from the floor, and some lifts can be from varying heights. Lifting objects greater than 20 pounds should try to be done within an employee's strike zone. The strike zone you may recognize from the sport of baseball is approximately from the thigh to the chest. The human body performs its most efficient lifts in this range. Try to avoid reaching above your shoulders or bending awkwardly below the knee during lifts in excess of 20 pounds or more. The act of reaching or bending already places your muscles in unconventional and stretched positions. Adding weight on top of these unconventional positions puts the body at an elevated risk for injury. When lifting and carrying something, it is advised to keep the item as close to your body as possible. Carrying heavy objects with arms extended away from your body places additional stress on your back. Your supply chain pro's tip is to hug the item if possible, and it is within your safe lifting capacity. While this might feel a bit awkward or funny, it does respect safe lifting principles, and it also increases your points of contact with the item being lifted. If the item needing to be lifted is overhead, avoid stretching if possible. Use a tool to bring the object down, or use a step stool or a ladder in order to go up to the item. Introducing step stools and ladders to reduce lifting injuries can create an elevated fall or a secure foot placement hazard, so be aware when using these tools and understand the additional risk that you are introducing yourself to when working above your head. If the item you need to lift is low, such as on the bottom shelf of a cabinet, use the tripod technique to pull the item out. Place one knee on the ground next to the object you are lifting. After obtaining the object in your hands and pulling it close to your body, rest the weight of your torso with your arm on your leg instead of your back, and stand up as described earlier in the video. There is a type of personal protective equipment called a back brace or a lifting belt that can assist to provide support when lifting on the job. This was covered in the personal protective equipment video on the channel. These tools are designed to support, however, will not prevent a lifting injury. Continue to follow these safe lifting techniques even when wearing a belt. If you are ever on the job and experience a sharp pain in one of your muscles during a lift, make sure that you stop what you are doing and report it to your supervisor. It's better to be cautious than keep working and further injure yourself. Safe lifting techniques are something that can benefit any employee on the job, from the warehouse to the construction site to the office. Ensure that you're lifting safely so that an injury does not get in the way of your life and well-being. Do you know anyone who sustained a soft tissue injury on the job due to improper lifting technique? If so, share your experience in the comments below. If you found value in the content of this video, like and subscribe. This is your Supply Chain Pro, out.